Hi, Mr. Rodriguez. How are you?
Really, this is a side of the story that's not generally understood.
It's not fair for the doctors, it's not fair for the patients.
This drug shortage story is about supply and demand for some, but for Georgina Rodriguez, it's about life and death.
I just feel so weak all the time. I'm so tired.
Yeah.
Rodriguez was diagnosed with leukemia 73 days ago. As if that weren't enough, her first treatment was delayed due to a shortage of the cancer-fighting drug cytarabine.
Within a few weeks, I have to have it again. But I'm scared because there's a shortage, and what if I don't have it anymore? What am I going to do?
What we do is try to scrounge among all the pharmacists and the hospitals in the city and try to calculate how much is remaining. So we ration out cytarabine. We even use the last drop. Thanks, Adams. How are you doing?
Dr. Swaminathan Padmanabhan at the Cancer Therapy and Research Center says someone should have seen this shortage coming.
I don't think this should happen in the United States. If we line up 4 or 5 people and so we can give them one after the other. And so we have to do a lot of rethinking and creative ways of getting around this shortage. And if that's the case, then we'll be able to evaluate the bone marrow.
While Dr. Padmanabhan would like to focus on practicing clinical medicine, he's often too busy, worried about logistics and planning. Now patients are feeling the pinch.
I had to send a patient to Mexico because in Mexico, right across the border, there's no shortage.
The demand for cytarabine is high. There are only 3 makers in the U.S. 2 of the manufacturers report various production difficulties, and the third company can't keep up. There are efforts underway to import the drug from another country, but that can't happen fast enough.
We had saved some for you and Christus. And I don't know if it's going to be there next week.
Celia Adams was diagnosed with leukemia last September. She's been waiting for 2 months to get one final life-saving treatment. Only this drug can cure her. Without it, there is no cure. Doctors say she's been waiting too long.
Because I feel at this point that my life is kind of on hold, and it's very frustrating.
Cytarabine has been around for more than 40 years. It's now a generic drug, but some hospitals are paying almost $1,000 for a vial of 2 grams that would normally cost $15.
These are things that we simply either don't have or we have such a limited amount we couldn't even, if one of our sister facilities asked for it, we really couldn't give it to them.
Mark Richardson, director of pharmacy at Christus Santa Rosa Healthcare, says this is unprecedented and would not have happened 25 years ago.
Manufacturing delays, back orders.
Over the last 2 years, he's seen a 300% increase in drug shortages and drug recalls. He says it seems things will only get worse.
You know, there's a question of safety, public welfare.
Third-party wholesalers are part of what's called the gray market. They take advantage of the perfect storm by stockpiling the drugs and selling them for a high price.
It's a free market, so they can charge whatever it is they want. It raises the question, it may be legal, is it ethical?
Pharmacies and hospitals do their best to manage drugs on the short supply list. News of a shortage should never reach the doctor and certainly not the patient.
Thank you, sir. Here you go.
We're fortunate, but I would describe it as we're limping along. We try to make sure we use them judiciously. We try to use them in a way where we eliminate any waste.
The FDA is in constant communication with the 3 makers that make cytarabine. A spokesperson says they can see the light at the end of the tunnel. Patients with the deadly disease are just trying to survive.
We should all have the same price for the medication.
Thank you.
While the gray market is unofficial, it is legal. Only the Federal Trade Commission can put a stop to the skyrocketing prices seen when certain drugs are hard to reach.
I don't think we deserve to die, because that's what we're dying. We're dying. We don't deserve to die just because of a medicine.
James Munoz, Kens 5 Eyewitness News.